Okay, Dr. Reese. So I'm just gonna ask you a few questions. Um, just give me. It doesn't have to be a long response. Just whatever you feel.
Okay.
Um, okay. So the first question is, when did you first become interested in becoming a chiropractor?
Chiropractor probably when I was 18.
Okay.
My dad got me into it. He's an acupuncturist, so he's like
Okay.
really into like holistic medicine and all that.
Okay.
So yeah, when I was
Okay.
18.
Pretty early on. Okay.
hmm
Okay. Second question: what seemed to be the most difficult process in your road to becoming a chiropractor?
I would say the schooling for sure.
Yeah.
Just like the long 4 years, getting to like the whole program,
Okay.
the classes, all that.
Okay.
Yeah.
What school did you go to?
I went to SCU in Whittier.
Okay, got it. Number three, while in school, what seemed to be the most interesting part of the process of learning your practice, and do you still feel that area is the most interesting part while you're working now?
I would say the X-ray diagnosis lab.
Okay.
That was definitely the most interesting. Just going through like the whole, learning process of like looking at X-rays, diagnosing them,
Okay.
and then definitely now, like when patients come into my office, looking at X-rays and diagnosing them, it's very interesting seeing like all like the conditions and like
Okay.
seeing fractures, seeing like spinal osteoarthritis, stuff like that.
Okay.
So yeah,
Do you get that like on a regular basis, like having
I would
look at
say on a
X-rays?
bi-weekly basis.
Oh wow.
Yeah.
Okay, so pretty often still.
Yeah.
Okay. Number four, how important was kinesiology or studying kinesiology when you were taking your courses in school?
It's pretty essential. I took a couple kinesiology classes. I took biomechanics 1, biomechanics 2, and then I would say it's pretty important just because like part of our diagnosis is just looking at the human body and how it moves,
Okay.
and then based on how it moves, we can diagnose like which muscles are firing correctly or which ones are not firing correctly. So
Okay.
yeah,
So yeah, pretty important to know
yeah,
a
definitely.
lot about
Mhm.
kinesiology. Okay. Next question. On average, what sort of clients do you see in regards to age? So, do you normally see like older or elderly people or younger people, or does it just does it vary? And do they have like a? Do you see clients that are in a certain profession, like maybe athletes or people that are doing like hard labor stuff like
Mhm.
that?
I would say my clientele or like my patient base is pretty diverse.
Okay.
But mostly I see people like between like their 30s and 40s.
Okay.
A lot of them do like a lot of manual labor. So
I
I see
see.
construction people,
Okay.
people that set desks a lot,
Okay.
a lot of housemaids for sure,
Mhm.
and then definitely like a lot of carpenters.
Okay. So people that are
Yeah.
doing like labor
Work.
intensive
Yeah.
job. Okay.
Yeah. Very like labor intensive jobs.
How about athletes? Do you see any athletes?
Right now I do. A lot of my patients have like sons or daughters that are in athletics in high school.
Okay.
So they bring them along. I see a lot of soccer players, football players, some track athletes. So,
Okay.
yeah.
And that's typically younger people. You're saying like
Typically
high school
younger
kids?
people, like between 16 to 18.
Okay.
Yeah.
I see. Okay. Next question. How often do you recommend clients to come in to see you if they are involved in any type of physical activity? And what sort of procedures do you perform on those clients?
I would say it depends on the individual and the activity that they're doing.
Okay.
Typically, if they're like the weekend warrior going to like the gym,
I see.
stuff like that, I would say maybe once a month, kind of like maintain
Okay.
like their spinal alignment and their muscle health.
Okay.
But if they're like in more intensive sports like track, football, soccer,
Mhm.
I would say bi-weekly to kind of maintain everything.
Okay.
And then typically on like the more intensive athletes, I do more soft tissue work. So
I see.
I work on their spinal erectors, stuff like that to kind of keep the spine aligned.
Okay.
And then I do adjust them, and I do perform some cupping to kind of keep the inflammation down within the muscles.
Okay. So it just depends. It just
Yeah, it really depends
activity.
on their activity and what they do.
Okay, I see. Next question. Is there anything you can recommend to those clients that are involved in physical activity that they may be able to do at home that'll benefit them and their bodies? Maybe on their own, like you're at home if, after a game and they're not able to see you right away, is there something that they could do?
Yeah, so definitely if they're like in an acute phase of an injury,
Okay.
I would recommend icing, foam rolling, Epsom
I see.
salt baths, stuff like that. Very like natural things to kind of keep the body moving how it should.
Okay.
But just like for wellness patients, I just want to stay like mobile and limber.
Mm-hmm.
Foam rolling is good. Stretching. I do prescribe them certain exercises to like take home to like strengthen their core,
Okay.
their glutes, and yeah, that's pretty much it.
Okay, cool. How do you stay current on new techniques and therapies within your field?
We do have a website for chiropractors that provides like studies, and then they have like a homepage that shows all their new articles that kind of keeps us helps keeps us up to date on like new things. But yeah, that's pretty much it. We use one website that all chiropractors use.
I see. Okay.
Yeah.
What are some of the worst cases that you've seen during your time as a chiropractor, and have you ever came across a client that was unable to benefit from your expertise?
Definitely. I've had older people that have like severe spinal osteoarthritis,
Really?
and it's to the point where I can't really get them to any like, you know, I can't reduce their pain. They're literally in pain. I take them through a whole 10-week course, and every time I see them, they literally come back saying that they haven't improved, and that's when I refer out to like, you know, an osteopathic doctor, a DO, or some kind of spinal surgeon that can actually help them.
So usually elderly people? That are
Yes, yeah.
Okay. I see. Do you find physical activities such as playing sports or exercising important? And if so, is it equally important for people to see a chiropractor often, regardless of what they're doing for a living?
I would say the more intensive your lifestyle is, the more, you know, active you are.
Okay.
I'd recommend people to definitely come see a chiropractor.
Okay.
But people that are, you know, it depends. Like if you're, you know, not super active and you're kind of in between, you know, your desk job and, you know, working out, like the weekend warrior kind of people, I would say every 2 to 3 weeks to like every month.
Okay.
But I would say people that are very sedentary, like desk jobs, stuff like that, I would say every 2 weeks, and same thing with people that are very active.
Okay. Okay. How about? I'm sorry. Let me find this last question. Okay. How rewarding is your job, and how has your knowledge of it benefited you personally in the physical sense? In other words, do you practice what you preach, and how often do you take time to do so? Do you take care of your body like on your own? Do you have somebody else, maybe like another chiropractor?
Yeah, I definitely have friends that are in my area that I go see every month or two.
I see.
My job is very taxing on my body, so I definitely work out. I keep my body, you know, healthy as much as possible.
Okay.
But yeah, I definitely have friends in the area that adjust me and take care of me.
I see.
So
okay.